Now this is Main Street, brought to you by WFAX. Here now with today's program is Doris Newcomb.
Dentistry from the Heart is an organization that reaches out to people in need all over the world, providing free dental care to those in need. Thousands of dentists and other volunteers donate their time. My guests today are two of those people who are donating their time to help the poor. They are Drs. Farshad and Bita Farhoumand, who are going to tell us about the program and their practice here, their part in how they're helping so many people in need. Thank you for being our guests today.
Thank you for having us.
Bita, tell us about what you're going to be doing at your clinic.
It's going to be on May 30th, and what's going to happen is it's a first-come, first-serve, and we're going to try to see up to 75 people, and they get to choose between if they want a filling, cleaning, or an extraction. Yeah, we'll be able to take care of one of those things for them. It's going to be a fun day, and hopefully a lot of people will hear about it and be able to come.
Where are your offices? Are people just going to be coming there, or do they need to call you in advance?
No, they don't need to call in advance. It's just first come, first serve. They just come and stand outside our office. Hopefully we'll be able to cater to everyone that day. Goal is to just try to see as many people as possible that really are in need of dental care and do not have the resources or finances to, take care of these issues that they have, these dental issues.
How large is this problem of people who are really in need?
There is a lot of people that we come across that need dental care badly. Young children, adults, and also a lot of old people that don't have the means to take care of their oral health. Right here in the capital of this great nation.
Do you think most people would be surprised at how many people are outside the system and really can't come up with the money either they don't have dental insurance or the costs are so high that it's very difficult for them?
There is a lot of people with fixed income, and the cost of living is increasing all the time, and they just cannot afford dentistry. It's unfortunate that there is no kind of insurance coverage with Medicare for everybody that needs it.
Really? So there's nothing that older people in particular can use for assistance?
That's right. For medical treatment, there is coverage. But for dental, there is not enough coverage. And the teeth are part of the whole system. And when your oral health suffers, the rest of your body suffers.
How did you become involved with this program?
I actually learned about it through a colleague of mine down in Florida, and I just thought, what a great idea, and I wanted to bring it to Northern Virginia and have us host this event.
And your clinic, tell us a little about your dental clinic.
So we're located in Tysons Corner in the new Walmart building next to the Sheraton Hotel. It's a new medical dental building, and basically our dental clinic is multidisciplinary, meaning that we have a general dentist and we have all specialists, a periodontist who does treats gum disease, places implants. We have an oral surgeon, an endodontist who specializes in root canals and emergency dentistry, and also an orthodontist. So we've made this concept of a team approach to dentistry where we all five of us doctors, we work together and look at all aspects of someone's oral health. Since it's really all linked, and that's just how we've decided to establish our practice and market it that way, because it's really, I don't think it's very, you don't see that much in this area.
I was going to say, that's quite unique, isn't it?
Yeah. It definitely makes things easier for us and more for the patient, because they don't have to go elsewhere to see another doctor for, more specialized care. It's all taken care of in-house. There's a lot more communication between the doctors. They're not kind of lost in the system. You don't have to make a phone call or send an email or, whatever to get in touch with the other doctor, see what's going on. I mean, it's really, communication is key, I think. And this basically helps the patient to get optimal care, to really be able to for us to talk about their treatment and what they need and what comes first. It's all really linked, so it's a great way to to practice.
Well, as you speak, I'm thinking my experience has been, your dentist refers you to someone else who you've never met, who is in a location where you've never been, and
right.
You're taking his word for it that you're going to be satisfied with that, whereas here someone can decide to have all of their dental needs taken care of.
It's difficult enough, I think, going to the dentist, and then you have to go somewhere else and kind of get used to that doctor and their office. I mean, it's kind of a barrier. So when you have everyone in-house, that problem is taken care of already, because if you like an office, you're used to it, you like the doctor, it's taking care of a huge barrier to care.
Well, you have to realize that dentistry today has evolved to the point that it's impossible for any one dentist to know everything. When I went to dental school in the early 70s, the knowledge of dentistry was so limited. Basically, all dentists learned the same thing. The materials we had were very few. We did not have porcelain at the time. We did not have composites. We did not have a lot of things. Digital x-rays and all of these things have come up. In the science of periodontal surgery, they do bone regeneration. We never even thought about those things. If a tooth went bad, we extracted it, we removed it. Today, we regenerate bone, we put implants. And this is just too much for one dentist to keep up with all of this. So it was difficult for me. And so we came up with the concept and the idea, with the help of my wife and my son, to bring those specialists into the office. A lot of doctors today have specialists that come in their office, but we have expanded it to include almost every specialty in dentistry that we can. And we are working on it to make it even better. And the interesting thing is that I, as an older doctor, I'm learning so much from these younger doctors. I learned from the orthodontist the new concepts. This Dr. Blvd works with us, just a graduate of University of Pennsylvania, and he has these bright ideas on treatment and expansion of the jaw done so much differently today using mini implants and things like that. So I am just
staying young through
I'm
us.
staying young through them. That's right. And I'm learning a lot, and I'm just doing the things that I like to do, that I'm good at.
There you go. You can this, because you did found this practice yourself. Is that right?
Yes, I've worked at it for many years, and the older I get, the more I enjoy it. And I don't see any retirement in sight anytime soon.
There you go. Retiring is.
Actually, we have the oral surgeon, Dr. Coleman, who is over 80, and he's still at it.
That's great. It sounds like such a pleasant, family-oriented, helping everyone, not only the parents, but the children who may need orthodontic care, and a place where a family can find all their needs met.
You'll be surprised that when I was practicing solo as a dentist, how much I used to miss. Treatment planning is the key for a successful dental practice. Treatment planning. And we missed a lot of the aspects of the oral health. We like orthodontics, for example. Orthodontics is not for children only. Orthodontics is for adults. There's a lot of adults that come into our office and their teeth are worn out.
Their jaws are dysfunctional.
Really?
It also has a link to sleep apnea. If your teeth aren't in the right position, it can actually constrict your airway. So there's many aspects that there's not a lot of education out there. That people just think teeth are cavities and decay and fillings and root canals. But there's so much more to it. There's so much more. And it's just, we try to educate each of our patients about that, and not just take care of their fillings, but if we see any other aspects that need to be treated, we take that into account. And that's one of the things I like about our orthodontist, Dr. Blvd, is that he takes into account the TMJ and the airway. He looks at everything. He just doesn't look at the teeth. He looks at the whole skeletal, muscular structure of the face, which is important, I think, for a child and even an adult. A lot of adults I talk to, they're like, oh, I'm too old for orthodontics. But, studies have shown if your teeth are not in the right place, it can lead to periodontal disease. It could lead to cavities. We're all really linked to each other, all aspects of the oral health. And it's important for people to learn and understand that.
I know they've learned so much in recent years, or not so recent, but about sleep apnea and problems with jaw problems and how to help people. There's so many things that I have a grandfather, I have to digress a moment, who had his tooth pulled when he was very young without they had no pain meds or anything. It was the tie it to the doorknob thing. Mm-hmm. And he never went back to a dentist his whole life. And look where we are today. Do you find that a lot of people, when you're going to be doing this event, and in people you meet, don't get regular dental care or don't get adequate care, don't do the entire, when you bring in a new patient, I'm sure there's an education process about all of the things that, the ways their problems with their mouth can influence their health?
The two biggest reasons I think that people don't go to the dentist is one, finances, and two, fear. So if you try to eliminate both of those barriers, there would be a lot more people that would go to the dentist. And they say, all about 6-month checkup. And there's a lot of truth to that. If you come to the dentist every 6 months, it gives enough time for us to find things that need to be fixed. And if you just let it linger, it's only going to get more expensive and get more, worse and more difficult to treat. The way that we try to do that in our office is through the finances part, at least, we offer an in-house dental coverage for people who don't have insurance. We come up with a program, no deductible, no maximum, no pre-existing conditions. It's kind of like our own in-house dental coverage for people. We also offer in-house interest-free financing, because a lot of people, they don't have all the money up front to pay for it. And, we have cool promotions here and there that we try to advertise for our patients. The second part of it is the fear part. So I think that a dental office, it just insults all of the senses of a person. The smell, the sight, the noise of the drill. I mean, everything is just insulted. And that's why people have such a fear of dentistry. So what we try to create in our new clinic is this atmosphere of peace, tranquility, openness. Because I think a lot of times people just feel so constricted in these small offices and small chairs and operatories, and it's a feeling of claustrophobia, and people feel like they can't escape. So we try to eliminate that and create kind of this sterile, big spaced environment with music to kind of cater to all the senses of a person. And
that's wonderful. Well, just for a moment, let me just review for our listeners the event that you're going to be having, offering care for people who can afford it free of charge, is May 30th, and it's part of a program called Dentistry from the Heart. And they do have a website. I believe it's dentistryfortheheart.org. You can learn more about the organization and the work they do. And tell us again where your clinic is and how people can learn more about your practice.
So we are located at 1500 Cornerside Boulevard, Suite 500 in Tysons Corner, Virginia. But people can learn about our practice through our website, www.avantidentistry.com. The Dentistry from the Heart has been around now for 13 years, and it's delivered over $5 million in dental care. We're really hoping that this will be a big event, and we'll try to, we want to see as many people as possible. The only thing is you have to be 18 years or older to participate. And for those people who are interested in having their kids see a dentist, there's an organization called Give Kids a Smile, and they're kind of the children version of Dentistry from the Heart. So they should try to, they can look that up, look that information up on the internet to see about that organization. But yeah.
Well, thank you so much for being our guest today. From AVANTI Dentistry, I've been speaking with Dr. Farshad and Bita Farhoumand, wonderful guests who are doing good for our community and their practice in Northern Virginia. Thank you for being with me today.
Thank you for inviting us.
Thank you so much.
This has been Main Street, brought to you each week at this time by WFAX. Your host on the program has been Doris Newcomb.